And joining me now for the latest updates on COVID-19 and in the region is our Medical Officer of Health, Dr. Paul. Welcome back, Doctor.
Good to be back.
All right, so unfortunate news, there is another outbreak in our region.
Yes, we had one case of an individual that developed symptoms at the Maxville home in Maxville. Essentially, we're there today doing an evaluation and testing everybody else just as a precaution. Everything seems to be under control. Just to note that Maxville was tested 6 or 7 days ago last week, and they were all negative. So it just goes to show you that you can turn positive. So just because you have negative the first time doesn't mean that you can't develop symptoms later. So this individual, a resident there, developed symptoms and was tested. Everything is stable. We're in there actually as we speak today to evaluate to see if they need any help, but everything seems to be stable. So that adds to it. We call it an outbreak because it's one individual. That now, by definition, it's an outbreak in a long-term care facility.
And it's also an indication, of course, of just the continued community presence of the virus. We know that Prescott Russell has been hard hit, but even for viewers that are watching right here in City of Cornwall and outlying areas of SDNG, it could pop up anywhere, like Maxville.
Yes, and this is an SDNG, this is Maxville. So, it's, again, it's starting to open up a bit, but we still need to have those precautions. It's still around us.
Right. And as we talk about that reopening process, Doctor, you've been working closely with a couple of different, or many different entities. Let's start and talk about farmers markets.
Yeah, we've had a lot of calls about farmers markets, and they are selling food, so they're technically an essential service. But because of the layout, the way they are, they promote a lot of people gathering together. So there's a central the Farmers Market Association of Ontario, I think it's called, has a protocol in place. We've looked at it. We're working with our partner health units across Eastern Ontario to have sort of the same approach. Essentially, there are two options, and we're going to be working with them closely so they can start going as early as next week, hopefully. In that they'll only be able to sell food. That's one thing. And there's two options. Either you have a modified way of setting up your table, setting up your food that's prepackaged so people can't touch it, infection control, those type of things, or what they call e-farmers market. Well, you can order online and go by and pick up, like a curbside pickup. So we're going to be working with them locally so they can, do the appropriate precautions and necessary modifications to the way they do business. And again, I'm stressing this is only for farmers markets that sell food products.
And another entity that you're working closely with and have been receiving a lot of questions from is, of course, in regards to church services. And we know a lot of faiths have been able to adapt with online presences and services, but you've been working on a new idea. We've seen it done in other places, which is drive-in services.
Yeah. As of May 19th, the government has now exempted churches for the purposes of these drive-in type of setups. So I was speaking with one of our church leaders locally about it the other day, and I've looked at some of the precautions. You can't get out of your car, there's no communion or anything like that. So there are some logistic, I think, challenges to this, because you're going to have to make sure nobody gets out of the car. You need to have people spaced, the cars spaced between each other, that people can have traffic control and so on. So the bottom line is that they are allowed to have these. And again, we'll work with any church or any other religious entity that wants to do it. Like I said, there are these precautions laid out by the government, and we'd be happy to work with any religious institution if they want to go ahead and do it that way. For now, the churches have to be closed, though, to the public, and no mass ceremonies within the church until further notice.
And on that note, Doctor, thank you so much once again for joining me. As always, it's great to hear the light at the end of the tunnel, or see the light at the end of the tunnel, but as well, always being cognizant that we have to keep up to slow the spread. So thank you once again.
Thank you.